Okay, I'm going to be testing the ACL through the anterior jaw sign and Lachman's test, or anterior jaw test and Lachman's test. Patient comes in with sudden onset pain in his knee. That could have been from like a valgus force or a sudden stopping or rotation, which causes the symptoms within the knee. To test the anterior jaw sign, you want to lift your patient's leg up to a 90-degree angle, block off the foot, grasp the proximal tibia, bilaterally place your thumbs on the joint space in between the patella, and then apply a anterior translation down the shaft of the femur, or up the shaft of the femur, to test if you have any pain, laxity, or infield within it. A positive is pain would be an ACL sprain, and a positive for laxity or no infield would be an ACL rupture. And then within this test, you want to make sure that the hamstrings are relaxed, so you can have so it doesn't affect the test itself. If you can't get the hamstrings to relax, then you go to Lachman's test. You would roll up any kind of item like a blanket or a hoodie or a foam roller. And then you would place it on the affected leg, so that's more at a 45-degree angle or 20 to 30-degree angle. And then it's almost the same exact maneuver where you grasp the proximal tibia, bilaterally placed across the joint, and then you would apply a anterior translation to that surface to see if there's any pain, laxity, or infield there. Common demographics for an ACL injury are most typically females, but it can be it can be male or female, usually ranging from 14 to 25 in the typical cases that are in some form of athletics or excessive exercise. Imaging that would help this injury or help identify what's going on in the knee would be X-ray that would identify if like you hear a popping, could identify some kind of fracture within the joint. A MRI would look at, see if there's any swelling in the knee, or if there is a tear in the ACL. The Lachman's test is more for an acute sign of an ACL injury. That'd be more on like the field side if it happened on site. I think that's it. Yep. Ranges of motion, ranges of motions that are most affected with an ACL injury would be extension, active or resistive. The mechanism of the injury is most commonly through hyperextension, through hitting the tibia, on the proximal tibia. The MRS wouldn't change since it's a ligament, so there'd be no change there. Yeah, thank you.